uproar on social media, and members of parliament have shocked and asked Kenyans with their demand that they be provided with a standby emergency chopper just in case one of them is overwhelmed by the coronavirus following the death of Matungu Member of Parliament Justus Murunga. The demand made by Kwanza MP Ferdinand Wanyonyi, seen as insensitive by doctors while appearing before the National Assembly Committee on Health, made public their pain at the front line. Alan Ochanda reports.
As Kenyans brace the pangs of the coronavirus pandemic, healthcare workers who are serving lives at the front line are now threatening to stay away from work. KMPD officials, while appearing before the National Assembly Committee on Health, shed light on their plight. The harrowing experience getting emotional.
We have cried a lot. We have died. We have really suffered. We have been abused. We have been used by this government. We consider ourselves children of a lesser God. We have 18 days to avert this strike. On 7th of December, we shall stay at home.
Politics is not logical. So please, let's not even mention things that bring politics in our hearts so that we deal. When we are supporting doctors, it's not because they're special, it's because without them, Kenyans are dying.
The tears, to many, may however be insincere, as Kwanza Member of Parliament Ferdinand Wanyonyi, a member of the very National Assembly, was on Tuesday quoted imploring upon the Speaker of the National Assembly, Justin Muturi, to ensure members of Parliament have a standby emergency chopper for their evacuation once any of them is overwhelmed by the virus. This coming in the wake of the doctors' cry for lack of PPEs, delayed salaries and allowances.
Solidarity forever.
KMPDU regional branches already marshalling their members to down tools. Elgeyo Marakwet and Bomet under Davji Atela blaming county governments.
This is quite unfortunate because we'll have all the cadres and all the specialists and consultants out. And this is brought about by the failure of the county government of Bomet to, number one, implement the CBA of 2017, which was signed by the county on 6th of October. We've tried to negotiate with the county, but the county has totally failed to implement this particular CBA.
I appeal to the national government to ensure that this money is released in time, so that we don't find ourselves with the crisis where workers have not been paid for 1 or 2 months.
In the midst of the war, and some of the frontline soldiers are already wounded, with some now threatening to down their tools due to lack of PPEs at their places of work and delayed salaries, thus threatening the war against the pandemic. Alan Ochanda, KTN News.
So that chopper question and the ordeal of healthcare workers is the reason we are speaking to Daisy Amdany, Executive Director, Community Advocacy and Awareness Trust, to pick her mind on the state of health in Kenya. And thank you so much, Daisy, for talking to us here on KTN News Center. You're talking to Brenda Zeda Radido. So let's straight away begin this interview with first things first, the statement by the MP demanding for choppers for members of parliament. Kenyans look at this as misplaced priorities.
Good morning, Brenda, and thank you for having me. I think that Kenyans really need to be outraged. Our members of parliament seem to have lost touch completely with the realities of what is happening around us. They have become so selfish that the only people they think about is themselves, yet their responsibility being in the House is actually to represent the interests of Kenyans. But they seem to have interpreted those interests to mean personal interests. They are talking about being airlifted to hospital facilities. Do they know that hospital facilities are full to overflowing with patients who the medical staff, hospitals are currently overwhelmed by the situation? These are the same members of parliament, the same parliament that has refused to address itself to the corruption in the healthcare sector. And so now when they see that everybody is threatened, they are trying to isolate themselves and give themselves special favors. Now, crunch time has come. They have to suffer the same fate that Kenyans are subjected to on a regular basis. The MP who passed away didn't need to die, but he passed away simply because they have not done their job and they have not upheld their responsibilities to the Kenyan people by ensuring healthcare for all, which, by the way, is a constitutional right guaranteed under Article 43 of our Constitution. And the same Constitution in Article 21 requires that the state shall take the necessary measures to ensure that Kenyans actually enjoy those human rights so that they're able to live lives of dignity. It is undignifying when you die simply because there was no intervention, because the facilities were ill-equipped. That is a lack of dignity. And now our legislators are being faced with the indignity that they, by their own dereliction of duty, have subjected Kenyans to. And so let them, in fact, nobody should, because it is through the taxpayers' money that costs for any airlifting would happen. These same members of parliament say nothing when the Minister for Health, the Cabinet Secretary for Health, at a press conference tells Kenyans that the NHIF will not cover their costs, despite it being a requirement of the law in the Constitution that we are supposed to have the highest standard of health care, and they are supposed to intervene in such a situation. Yet, these members of parliament, they enjoy health insurance on the taxpayers' coin. So I think that Kenyans should be outraged, and the Speaker must not accept this. We cannot accept this. It is time for us to face up to the facts that the members of parliament are now subject to the daily struggles of Kenyans.
Right. So Daisy, allow me to cut you short. Just hold on when it comes to that discussion about NHIF. We'll be getting to that later on. But you know, when you talked about this whole scenario of COVID-19, the statement by Kwanza MP has act Kenyans the wrong way, and it has also actually opened the eyes of members of parliament. You've actually echoed what Machakos Governor Alfred Mutua talked about some time back. Actually, earlier this year, when reported the first case of COVID-19, he said that during this time, you know, legislators are not actually able to travel to other countries for treatment. Then it clearly means that the government, and I'm talking about, you know, the government at large, both national and the county governments, need to ensure that the hospitals are well equipped, that we expand the health sector.
Absolutely. In fact, we need to have a law that bars any public servant, anybody who is paid by the taxpayers' money to seek medical treatment in a private facility. They must be attended to in public facilities because by their role, they are the ones who put in place the measures to ensure that those public facilities can be useful to the ordinary mwananchi. So they should also be treated in the same facilities. In fact, that's perhaps the only way that we will be sure to get proper health care, because if they know that they cannot travel, it should be against the law for any leader in Kenya, any public servant, to travel abroad for treatment unless that treatment is absolutely not available in Kenya, maybe because of technology or anything, but not because of facilities. We should not allow for any of our leaders to seek treatment in private facilities or abroad. They should go to public hospitals. And you know, I remember when Charity Ngilu was the Minister for Health, one time when she was ill, she actually went to Kenyatta National Hospital. She went there to be treated. And she said, I cannot, as the Minister of Health, expect Kenyans to seek treatment in public facilities, and I myself don't go to a public facility. And that should be the attitude of our leaders. They should be subjected to the public facilities. If it is ambulance, let them be given those ambulances or the ones that are not there. We have seen instances of people who have wheelbarrows as ambulances, simply because the government has really left people to their own devices.
All right,
and this really... Sorry, Brenda. Yes.
So Daisy, it looks like you're agreeing with the MPs, because when talking about the ambulances, now the legislator, the Kwanza MP, also suggests that they want an equipped ambulance for the legislators who live within Nairobi County, where access to medical care is easier.
You know, let me tell you, healthcare should be available everywhere. It shouldn't be that it is in Nairobi where people get good healthcare. There are people everywhere. We have people in all parts of this country. I should be able to get very good healthcare in Turkana, in Samburu, in Mandera, in Wajir, wherever I am, because we have Kenyans in all those places, and all those people send us legislators to Nairobi to represent their issues and to ensure that resources are allocated for that. We have members of parliament, we have county governments, we have all that. So instead of them looking for ways of continually enriching themselves and living large off the public purse, they must be subjected to the exact same facilities that we as ordinary people have to put up with.
All right, and I want us to move now to the plight of Kenyans. And before we move to that, just in a minute, Daisy, I need your response on Mutula Kilonzo Jr., the senator. His tweet, this is what he had to say. Let me just read for you that tweet, Daisy. He says that we, in bracket, the MPs, are demanding for helicopter evacuation while my friends in KMPDU, this will lead us to a discussion on when it comes to the plight of doctors, while my friends in KMPDU are asking for allowances, protective gear, for doctors to try save COVID-19 patients. We deserve the vitriol directed to us by the public.
And he's right. They do deserve the vitriol directed to them as the public. Let me tell you, KMPDU have constantly been raising the issues that doctors are grappling with. And what has been the response of the state? They have called them selfish. People say they don't care about life. They've put money before life and everything. But these, our doctors, honestly, they work under such difficult conditions, you know? And we don't value them. We keep seeing that they're asking for too much and everything. And now things have come to a head. Nobody is talking about the doctors that we are losing. Do we know the kind of investment that goes into training a doctor and the resource that we are losing? The government is quoting an additional crisis for every healthcare worker. And I'm not trivializing the loss of life, because indeed we are losing lives of ordinary Kenyans, but we are losing a critical human resource because our government has been irresponsible. For every doctor, nurse, or consultant that we lose, that is a critical human resource that we are losing, and that is a gap in the healthcare sector. We are losing teachers because our government has been irresponsible. And let me tell you something, Mutula Kilonzo can tweet all he wants. Nani, the Nikal can cry all he wants, but how dare they? If our leaders are lamenting, what are we supposed to do as Kenyans? They are in there to sort out this mess, and they've not been sorting it out. They are busy entertaining us with 2022, BPI, and all this. Meanwhile, everybody is dying. What kind of irresponsibility is this? The real crisis that we have in Kenya is a crisis of leadership. We have a moral crisis and a crisis of leadership.
And the other crisis, actually, Daisy, that is going to be affecting the health sector is that 21 days strike notice, but that has been issued by doctors through the KMPDU, I mean their union officials, because they're saying we're not well taken care of. We, the foot soldiers, are dying. We, the foot soldiers, are hurting. We, the foot soldiers, have been infected by the virus while working, attending to Kenyans.
Brenda, anytime you send even your soldiers out to the battlefield, you do not send them without protective gear and without ammunition. That is what we have done with our doctors. Our government has sent our doctors to the front line of a lethal pandemic, a pandemic that we have had time, because we saw before it came and began to ravage us here in Kenya, we saw what it was doing out there. And instead of preparing adequately for it, the government has been completely derelict. Questions: where are the donations of the PPEs that were given? Where are all? We've been given grants and support by external partners to help our frontline workers, who are the doctors, to be able to address this thing. Nothing. Parliament has abdicated its role, killed the report. Our doctors have been crying. They have been raising the alarm, and I agree with them. They need to think about themselves first, because they also have families.
So you agree with that strike notice?
They have their own lives and their families to protect.
So you agree with that strike notice?
I do agree with the strike notice. If the government is serious, see, they have put money aside for BPI. Stop with BPI, channel all that money to the healthcare. By the way, in a health pandemic, the government has a responsibility to cover Kenyans fully, healthcare workers and the sick. That's how you deal with the pandemic. So instead of channeling money to useless things that do not benefit Kenyans, can they channel that money right now to the healthcare workers to avert that strike? So if not, let the doctors strike.
So then it begs the question, allow me to ask you this question. Who is fooling who, or who is failing Kenyans? Because anytime health workers say they don't have PPEs, they don't have health insurance cover, especially for doctors who've contracted the virus when working. On the other hand, from Afya House, the CS for Health, Mutahi Kagwe, says, we have given the health workers all that they need. There's nothing that is missing.
Okay, let me ask you. We know that from the executive level, the level of corruption, the level of dishonesty of our government is very high. I don't believe that our doctors would put themselves in a position where they would be the ones lying to Kenyans. They've gone into the fire for us. They have been dying. They're dying as they try to save lives, okay? And one of the reasons why they are dying is because they don't have the necessary equipment to keep themselves alive and to protect themselves as they work on saving Kenyans. We wanted to see what would come out of that report from the health committee in Parliament, in the Senate. What happened? They killed it. So who would you believe? Would you believe the CS of health, or would you believe the doctors? We know that our healthcare sector has been riddled with corruption. It has been an area where people have gone full front on money making, not understanding or not even caring about the repercussions of their actions to the wider Kenyans. And now we have come to crunch time.
Right.
I believe the doctors. I do not believe the CS. I do believe that the buck actually stops with Parliament. By the way, if there's anywhere that we should lay blame, it is in Parliament. Why? Because Parliament is supposed to oversight the executive. They are supposed to ensure budgets that are allocated actually go to the intended use. So the Parliament has been derelict in its duty and has simply been a marionette for the executive. So the buck really stops with Parliament because they are the custodians of the people's purse, they are the representatives of the people, and they are supposed to oversight that executive to ensure that that they do what is required of them. For instance, why hasn't the CS been summoned by Parliament to explain why NHIF will not cover Kenyans? That is something Parliament should do.
In fact, Daisy was about to get into that discussion about NHIF. Actually, the CS Daisy appeared before the Senate Health Committee on the 4th of this month, saying that NHIF and other health insurance companies cannot cover COVID-19 patients because the CS argument was it's too costly, and instead directed KEMSA to release the PPEs and other medical equipment to the county governments. And this change of mind comes 4 months after, 4 months before, actually after NHIF said, okay, we will cover COVID-19 patients. That was in July. Then come November, the CS comes out to say, no, NHIF cannot afford to cover COVID-19 patients because it's too costly.
You can't tell us it is too costly. The loss of life is what is costly. The loss of human resource is what is costly in this country. And how dare the minister come and tell the Parliament that they cannot meet what they are required to meet? Then he needs to resign. They need to tell us why NHIF cannot cover. People have been paying their NHIF. We've been remitting our statutory deductions. We need to know why NHIF cannot pay for us. Where is the money? What is the money being used for? Government cannot tell us it is too expensive. Government must find the money for the treatment of Kenyans. One thing that in a health crisis government is required to do is to ensure timely treatment. Because for as long as people cannot get treatment, it means that the disease will spread. So it baffles me. Who is this team that is advising the CS and advising the executive about how to handle the pandemic? But on one hand, the minister is telling us they don't have money to cover COVID patients. What is the cost of COVID? What is the cost? Can they tell us what would actually be the cost, assuming worst case scenario, what would be the actual cost of treating COVID patients? And let's look at it vis-a-vis the priorities they've put of funding BBI, because it is our money that they're using to fund BBI. We're saying it's not a priority. It's a priority to save Kenyans' lives. It's not a priority to run a referendum campaign. So channel the money to NHIF and to the doctors.
All right. So Daisy, just stay with me. We're taking a short commercial break. But Daisy, I'll be giving you the response to the CS, saying that...
This is KTN News.
What the government is actually doing. So we'll talk about that, Daisy. I'll talk about it with you after the short commercial break I'm taking right now here on KTN News Center.